Okay. Today's webinar is brought to you by United Concordia Dental, who is an MHPA Bronze Partner, a longtime supporter of MHPA and our member health plans. We thank them for organizing today's presentation. The mouth is connected to the body, the link between oral and overall health. With that, I'm excited to turn things over to Gary Rosenfield, who serves as Director of Medicaid Product and Market Development at United Concordia Dental. Gary?
Thank you, Patrick. And first of all, I want to thank Patrick and MHPA for giving us this opportunity to share our perspective on this really important and often overlooked part of healthcare. And I also want to just take a moment to thank everyone who's out there tuning in. The work that you're doing every day to improve the lives of the Medicaid population is so important, especially today. So, just want to start like good morning to those on the West Coast, good afternoon to everyone on the East Coast. As Patrick said, my name is Gary Rosenfield. I'm the Director of Medicaid at United Concordia Dental, and I am delighted to welcome you to today's webinar entitled "The Mouth is Connected to the Body, the Link Between Oral and Overall Health." We're thrilled to be hosting this, and just welcome collaboration with MCOs across the country as we really are committed to drive better total health outcomes for our members that we serve. So at United Concordia Dental, and you'll hear me say UCD, that's so that's interchangeable from us. We recognize the critical relationship between oral health and overall well-being, and this webinar will reflect our commitment to driving comprehensive health equity. Before we dive in, just want to briefly introduce you to United Concordia Dental. We might be the biggest dental plan that people may not have heard of. But just so you know, we've been doing this for over 50 years. We've been a leading dental benefits provider. We're a diversified business unit of Highmark Health. We're dedicated to improving the total health through oral health, focusing on wellness and integrated care solutions. We proudly serve 12 million members today in all 50 states and Washington, D.C. We hold the largest single payer contract in the history of the United States as the TRICARE dental solution for active duty military. And in addition to that, we currently serve 500,000 Medicaid members across 3 states. And, we have plans to continue that expansion. Today, for today's discussion, I am really honored to introduce our esteemed Chief Dental Officer, Dr. Roosevelt Allen. I could go on for hours, talking about him. He's a retired 2-star general with 32 years of service in the Air Force. He's a doctor of dental surgery, graduate of Howard University, a master of the Academy of General Dentistry. He holds fellowships in both the American Board of General Dentistry and the American College of Dentistry. In May of 2024, NYU School of Dentistry honored Dr. Allen with the David B. Kreiser Medal for his remarkable contributions to oral health policy. Dr. Allen is leading the efforts to use oral health as a catalyst for driving better total health outcomes for the Medicaid and underserved populations. And it's an honor for me personally to serve at his side in those efforts. And so here's a quick look at our agenda for today. There we go. We have it broken up into 4 components. So we're going to talk about the oral systemic connection, so understanding the critical link between oral health and overall health. The social determinants of health, recognizing and addressing the factors that are affecting dental care access and disparities. Medical dental integration, or MDI, so exploring how UCD's MDI model and its benefits for comprehensive care. and purpose-driven partnerships highlighting how UCD partners with Medicaid health plans such as yours to enhance preventive care. Our primary objective today is to demonstrate UCD's commitment to these 4 key areas for the benefit of the Medicaid population we collectively serve. We aim to leave you with a clear understanding of how integrated dental care could improve the management of chronic conditions and reduce overall healthcare costs. And as Patrick mentioned, you could use the Q&A tab to submit your questions during the presentation. I'll jump back at the end to answer as many as time permits. And now, without further ado, I'm pleased to turn it over to Dr. Allen to delve into the heart of our presentation. Dr. Allen?
Well, thank you. Thank you so much, Gary. And you can stop sharing and I will start sharing. First of all, I want to thank you, Patrick, and thank you also, MHPA, for the opportunity to speak to you today about all systemic health and the importance of medical dental integration, and just to share with you some of the work that we are doing at United Concordia Dental. Are you able to see my screen?
Looks great.
Yeah. So I thought that as we get started, I thought we'd do a little icebreaker. We have a few poll questions that I thought we would ask just to get a sense of knowledge about all systemic conditions, medical dental integration, and in that area. So Patrick, why don't we start with the first poll question? So the first question is, how many chronic conditions are generally correlated with gum disease? And so I guess you'll have an opportunity to vote, and then Patrick is able to see how those scores are coming in, and we'll be able to show the results of that.
Exactly. All right, still coming in. Okay, going once, going twice. Okay, I'm going to share the results.
Well, actually, the number of chronic conditions or conditions in general that can be associated with gum disease is really close to about 60. Whether you're talking about cardiovascular disease or circulatory diseases, there are various cancers, there's gastrointestinal illnesses, kidney diseases, respiratory illnesses. We'll talk about some of those a little bit later, but the actual answer is roughly close to about 60. Can we go to the next poll question?
You bet. Just 1 second. Here we go.
True or false? More than 50% of adults in the US have at least one of the top 10 chronic conditions.
Okay. Pretty one-sided, but they're still coming in. All right, going once, going twice. Okay.
That's absolutely, 100%. Wow, that's correct. We're going to talk about that a little bit later, but the adults over 50 years old, on average, they have about 50% of the population will have at least one chronic condition. And then we'll learn that as you age, even if just by 5 years, when you're 55, what we find is that about 85% of people of adults will have at least 2 chronic conditions. So absolutely correct on that. Next slide, next poll, please.
Okay, I will launch number 3. Here we go.
What percent of adults will have some form of gum disease?
Okay, good responses coming in quick. Okay, going once, going twice. Okay.
Okay, the answer is about 70%. And it's important to recognize when we talk about gum disease, we're not only talking about gingivitis, but we're also talking about periodontal disease. I think a lot of people think when we say gum disease, they focus and think solely on periodontal disease, but gingivitis is also considered gum disease as well. So that's why it's about 70%. Next slide, next poll, please.
Okay.
True or false? People with chronic obstructive pulmonary disease may be most likely to develop some form of gum disease.
Okay, another one-sided, I think, question. They're still coming in. Okay.
Yeah, pretty straightforward. There are a number of conditions that are more prone to developing gum disease. COPD is one of those, as well as those who have diabetes and some of the others. Next one, please. And I think that's one more we have, the last one.
Yep, here's the last one.
Blank is the #1 chronic disease in children.
Great responses. Keep them coming. All right, going once, going twice. Okay.
And the answer is correct. Cavities. Cavities is the #1 chronic disease that we see in children. So thanks for participating in this poll. I think it gives you some sense of knowledge as it relates to medical dental integration. As Gary had indicated, I'm going to spend the next 45 minutes or so speaking to you about United Concordia and the work that we're doing as it relates to medical dental integration and the all systemic link. I think it's important to understand, first of all, that at United Concordia, total health is really the foundation of our organization. It is the foundation of who we are. We truly believe that if we want to improve health outcomes for our members, that there really has to be a collaboration between all aspects of the healthcare system. We understand that health outcomes can be improved by focusing on oral health, physical health, behavioral health, the health of the community, social determinants of health, as well as the financial health as well. And all of those will have an impact on health outcomes for our members. And so, as I mentioned earlier, total health is like the pillar of our strategy. It's who we are. And you will find that out in the next few minutes, just with some of the things that we're doing as we focus on that. Because again, our overall objective is to improve the overall health outcomes and to provide wellness to our members. Next slide. So when we talk about dental, I guess I'm advancing this. When we talk about dental disease, I think it's important to recognize that there are really two most common dental diseases. One is tooth decay or cavities, and the other is, as I mentioned earlier, gum disease, periodontal disease, as well as gingivitis. When we talk about cavities, I think you can see in this slide that it is the #1 chronic disease in children. Roughly 57%, about 60% of 52% of those aged 6 to 8 and 57% of those aged 12 to 19, they will have had at least one cavity either in their primary tooth or in their adult tooth as well. The reason that that's important is because the cavity rate that is actually seen in early childhood, it is generally a predictor of what the caries will be like for those individuals as they enter into adolescence as well as adulthood. So if we are able to, again, reduce and minimize the amount of cavities that are present in young kids, that has a positive aspect in the future with those individuals. When it comes to gum disease, we see, again, almost 50% of adults over the age of 30 will have some type of gum disease. And again, that is gingivitis as well as periodontal disease. The reason that that's important is because there has been a number of studies that will show that gum disease is a risk factor for nearly 60 or so adverse health conditions, including Alzheimer's, diabetes, heart disease. We also know that gum disease can have an impact when it comes to pregnancy. There are a number of studies that have shown that you have an increased risk of a preterm birth as well as a low birth rate child or baby if proper dental care or gum disease is not managed in a pregnant woman. The reason that this is important, if you look at the bottom as it relates to impact, that when children have cavities and decay, they're not able to go to school. Many of them are in pain and they end up losing school hours. And this shows roughly 34 million school hours are lost each year just because of unplanned emergency dental care. I think it's also important to recognize that when we talk about unplanned emergency dental care, there is a bill associated with that if these individuals go to the emergency department. And that's what many of them do. They end up going to see someone, they don't have a dental home, and they end up being seen in the emergency room, and there's a significant cost associated with that. We also know that individuals who have periodontal disease and other health-related conditions, that there is loss in productivity because of people, again, because of dental disease and not able to go to work. And there's some significant, obviously, concerns as it relates to that. And so as we look at dental disease or oral cavities and periodontal disease, and we relate that to overall health conditions, we see that people with chronic diseases, as I mentioned earlier, they can be impacted by the oral health of these individuals. Again, I mentioned earlier, 47% of adults have some form of gum disease. And as I mentioned earlier, about 70% of these will have periodontal disease or gum disease sometime in their life. Now, gum disease can, again, affect a number of individuals. It seems like as you get older, obviously you have more issues with that. And again, if you look at the bottom, there's some significant healthcare costs associated with that. When it comes to dental care alone, the nation spends roughly $124 billion per year on dental care. And when it comes to other healthcare costs, about $4.3 trillion is spent. Now, why is that important? That's important because if we're able to improve health outcomes for a number of these individuals by collaborating on what we're able to do together, we can decrease some of these costs. I mentioned earlier, 50% of adults in the US will have at least one of the 10 top chronic conditions. That increases to 85% by the time they turn 55. And you'll see on the right-hand side that over 25% of adults will have 2 or more chronic conditions. That's pretty significant. And that group, 60% are over the age of 55. Again, concerns about that would be obviously the healthcare costs, but also quality of life, increased risk of death, and things like that. So the social determinants of health. I think you can't talk about chronic conditions without talking about social determinants of health, because in essence, one's overall health and the chronic conditions that they actually end up getting, it's impacted by so many factors. Things like who they are. Individuals, because based on their genetics, either their sex, their age, or their race. Also, ethnicity can have an impact on various diseases and health conditions that they acquire, but also the things that they do. We all know that if you eat a proper diet, if you exercise, if you limit certain substances, especially alcohol, if you don't smoke, if you're able to manage your stress, that can have, all of these things can have an impact on your health. But also the conditions in which people grow up, where they live, where they work, where they go to school, where they play. We find that can have an impact as well on one's overall health. Obviously, you can understand if people are living in an area where there are concerns about the environment, whether there's smokestacks or other pollutants that are in the area that can have an impact on their health. Their access to education. We all know that, and you'll see a little bit later, that those individuals who have a greater amount of education, they have better health outcomes. Obviously, the economy and economics plays a role, primarily because a number of people, when they have jobs, they have dental insurance, or they have access to dental health care or other health care as well. And so that can play a role. When they have the proper foods to eat, obviously that can have an impact. And one of the barriers that we find with a number of the patients in the Medicaid population is transportation. Individuals who don't have transportation or access to transportation, whether it's there's no buses or subways or other ways of getting to appointments, that obviously can have an impact. And then the healthcare services that are actually available in the neighborhood. If individuals don't have dental officers or hospitals and they have to travel great distances in order to receive care, I think you can understand why that can have an overall impact on their overall health. And this really provides, I think, a good illustration of just how one's health can be impacted by various factors. Roughly 40% of one's health can be impacted by just socioeconomic status. You heard me mention earlier about job status, family support, income. When they do have those, they are able to have insurance they're able to fully understand, when they're educated about what's going on as it relates to their health. I talked a little bit about their physical environment and what they may be exposed to. We talked earlier about behaviors that people practice and also their access, what's available in the local area, whether they have dental facilities or hospitals or pharmacies, even if they have supermarkets in those areas, that can have an impact on their health as well. I think this slide is really important to demonstrate how social determinants of health can have an impact. We know that African Americans and minorities, that they have that social determinants of health can really increase the number of chronic conditions that they have. And the research shows that African Americans and Hispanics get diabetes, cardiovascular disease, many of those Alzheimer's, they get those at a higher rate than some others across this nation. What we also know is that individuals who go in for preventive care and periodontal treatment, where they're controlling that inflammation and the bacteria in the oral cavity, that they get better health outcomes as it relates to these conditions. And so I think that's important to understand. So when you look at this slide, it may be hard to see, but this is really broken up into a race, where we're talking about white, Asian, Hispanic, and Black. And you can see we're also talking about age. You can see this little small guy here. This is where we're looking at the percentage for children. We're looking at the elderly or more seniors. And then this is where we're looking at just adults. And what you'll see is this is a study that was done by the ADA, the Health Policy Institute, where they looked at a 10-year study. They looked at the difference between 10 years. They looked at 2005 and 2006, and then they went back and looked at 2017 and 2018 to see, and they asked a simple question: did these individuals have a visit to the dentist in the past year? And you can see for children that it's relatively, there's been some significant or some increases as it relates to children going to the dentist, more so in that 10-year period. You will see it's also increased for seniors as well. You'll see it's also increased for seniors as well, that there's been a significant increase in their ability to go to the dentist in comparison. And that's for all, looks like primarily across all races. Maybe in Asians, it looked like it remained probably about the same. But in essence, there was an increase in going to the dentist. If you look at adults, you will see it's relatively stayed around the same. That's concerning because you just heard me talk about a number of those chronic conditions that adults have. And so if they have the diabetes, the cardiovascular disease, the emphysema, they're not going in and they're not being seen for some of these conditions, and they're not getting dental treatment for that, it only exacerbates those problems. So that's why it's important to really focus on social determinants of health and to understand the role that that has. That's why it's important to try to get as many people into the dentist as possible to ensure that they're getting the care they need. At United Concordia, we focus, as I mentioned, on medical dental integration. We believe that all aspects of health, physical, oral, behavioral, financial, and social, that these are all important and they can all improve health outcomes when it comes to our members. And what we do is we focus on a sort of a three-pronged approach. We focus on the people, the products, and the programs that we have that allow us to focus on overall wellness and to focus on improving the oral health. When it comes to people, what we do is I think it's important to know that we are dentist-led. I think we may be one of the only carriers in the country where our president and our CEO is a dentist. Something else that we have, and I think we were the first carrier to have that, wellness consultants. We actually have dental hygienists that are able to work with various groups, various teams, helping them to understand that relationship between oral health and systemic health. They provide continuing education, they provide newsletters, they provide specific videos on different topics. Like of a large number of some of our clients in one particular group, based on the age, they may be taking a lot of medications. So they will do a video that talks about oral health and medications and how they can have an impact, especially as it relates to xerostomia, and how decreasing secretions in the oral cavity can have an impact on cavities and things like that. We also have a medical dental integration team. We recently hired a medical dental integrator consultant, an individual who's got a background as a dental hygienist, registered dental hygienist, but she's also worked as a nurse and was also has her master's in healthcare administration. So she's able to help us evaluate, research, look at various products and benefits that we should offer our members, and has really been a valuable member to our team. Really joined us about a year and a half, 2 years ago. And then we have various community advocates. And as I mentioned earlier, we also have dental hygienists that are part of our team as well. For the various products, we offer various products to our members that we believe help improve their overall health. We have pregnancy benefits. When it comes to financial health, we have value adds that provide a decrease in cost for like the Sonic Care toothbrush. We work with a company that allows for a reduction in price for all appliances that are used for sleep apnea. We also have now provide dental medical insights, which is a new product that we're able to provide to our clients that really provides them some insight on the dental utilization that's occurring with their members and how that relates to particular age groups, as well as with certain chronic conditions that individuals may have. And then we also believe it's important to be invested in programs. We are affiliated with Highmark Health, as you heard, and Highmark Health has a hospital system, Allegheny Health Network. In that hospital system, there are 14 hospitals, but in one of those hospitals, they actually have a residency program. And so we have invested in the medical dental integration by providing funding for an electronic health record that allows the dental clinic as well as the hospitals to really communicate about what's going on with their patients. We know that, and most of the studies show, that the lack of that bidirectional transfer of information between healthcare systems and dental facilities is one of the barriers to proper coordination and collaboration when it comes to overall health. And so we've made that investment in that facility to improve that coordination. We also partner with a number of academic and research institutions. I'm happy to say that we were one of the founding members of the integrative board with Harvard. Harvard has an integrative board that looks at oral and systemic health, and we were one of those founding members. We've been part of that for a number of years. We also provide oral health education and training in a variety of ways to our members as well as to our other customers. Excuse me 1 minute. We also have various programs where we focus on mobile dental clinics. You'll see a little bit later where we go out into the community because, again, one of the barriers that we find with a number of our members is their ability to get into dental facilities because of transportation and other things. So we actually have mobile dental clinics that go out into the communities. We've been doing that since 2019, and we've had a lot of success with that. And then in 2020, we started a charitable fund. I'll talk a little bit about that, about some of the work that we're doing related to workforce development, how we support social determinants of health, things like food banks, homeless shelters, the veterans, as well as Mission of Mercy, Team Smiles, things like that, as a means of giving back to the community. We believe, obviously, that there are a number of benefits when it comes to MDI. First of all, when there's a collaboration that's occurring between all the team members, you can get comprehensive care. You can improve health outcomes, as we've talked about at the start of this. There's a bit of research that shows that obviously you can reduce healthcare costs. And I think the reason you can do that and understand that is that individuals who are healthier, they don't go to the they don't go to appointments. They don't use healthcare facilities as much. And so if people are healthier, obviously you can reduce healthcare costs. When you collaborate and you work together, you can also provide early detection as well as the prevention of diseases. And obviously you can manage some of those chronic conditions much better, getting better health outcomes. So I want to just talk a little bit about some of the partnerships and some of the things that we have been doing at United Concordia in order to focus on this collaboration. The first one I'll talk about is something that we've done in the state of Pennsylvania with our Highmark Whole Care and our Medicaid population. We understand that diabetes obviously is a major concern. We have partnered with the Pennsylvania Coalition of Oral Health, Highmark Whole Care, and United Concordia. We're actually doing a pilot where we are collaborating on improving health outcomes for a number of those patients who have diabetes. When we look across the state, we see that 1 in 10 adults in Pennsylvania have diabetes. And based on their socioeconomic status, it's even 1 in 5 for some of those. Older adults in PA who have diabetes, many of them have lost their teeth, and a number of those have not visited a dentist as well. And so what we did was we started looking at our data based on various counties in the various regions that we served. And we wanted to identify those individuals who had both diabetes as well as periodontal diagnosis. And they had had gaps in care, meaning there had been no dental utilization for a number of months. And what we did was we saw that it was beneficial to partner with the FQHCs, the federally qualified health plans, because many of the dental facilities and health facilities are co-located, and we see a benefit to doing that in these areas. And so what we're working on is a holistic approach for better health outcomes. We've enhanced the appointment scheduling and that we've increased access to preventive services for these patients. We're actively working to get them in for their dental treatment. We're driving the treatment for periodontal disease, and we're seeing them every 3 months, every quarter. As I mentioned, the initial focus is on those patients where the providers are co-located. There is collaboration, obviously, between the medical and dental community. And what we're also doing is we're removing those barriers as it relates to the member experience. In Pennsylvania, there is a benefit limit exception that is required at times to receive some dental care. We are going to remove that for these patients that are in this study. We're also removing the frequency limitations that is associated, because what we want to prove is that if we can collaborate and provide the dental care and the medical care that's needed for these members, that we can get better health outcomes. We're also going to help if they need assistance in getting to appointments with transportation. And then we're also going to help with post-visit support as well. What we're hoping to see with this is an increase in preventive and screening as it relates to dental visits. We're hoping to see the A1C testing and monitoring rate will increase, and the member experience and satisfaction will actually go up. We want to see a decrease in A1C, hemoglobin A1C levels. Once we provided the dental treatment and collaborated with the medical community, we're hoping that the hemoglobin A1C levels will be decreased, and we expect to see a decrease in emergency department use for some of the non-traumatic dental care. And overall, we expect in the long run that there will be a decrease in overall health spending. This initiative just started. It's going to run for 1 year, and we expect to have results probably in the next 9 months or so. Something else that we've worked on, we listen to our members and our clients. Our clients have said that they're interested in having real-time data insights as to what's going on with their members. And so for various clients, we have actually developed what's called a medical dental insight product for them. It will tell them who is using the plan, how the plan or how the benefits are being used. And as I mentioned earlier, trends as it relates to various ages, prevalence, chronic conditions. It all depends on the amount of data that we have on these various clients. We're trying to work with health plans to get more data, but this is just sort of a snapshot of what we're able to provide our various clients. We can give them insights about their overall use of all of their members when it comes to the benefit. We can do a deeper dive looking at various age groups, providing insight about who's using the benefit, the top claims that are being submitted as it relates to these groups. We can also look at the utilization as it relates to caries treatment, operative treatment, periodontal treatment, preventive services, gaps in care. And if we have information about chronic conditions, we can relate those chronic conditions to visits and where there's been gaps in care. One of our products that we offer, we actually do collect information about certain chronic conditions that individuals will have. And members also have the opportunity to self-identify some of these chronic conditions as well. We're also able to look at various cost drivers about with children as to their visits and the type of care that they have been receiving. You heard me mention about the importance of tracking women who are pregnant. We can track their gaps in care, the amount of treatment that they've received. Those that have that are pregnant, we're able to diagnose if they not diagnose, but we can provide information as to whether or not they saw the dentist, how many visits they had to the dentist, things like that. We also think that being engaged with our members, we have a website called My Dental Benefits. We're able to track the clicks and where people are able to go in and look at educational material as well as utilization of their benefits, things like that. We're tracking that engagement because we believe patients who are more engaged, that they actually have better health outcomes. And so we're able to track that and work with members and clients on increasing that as well. Something else that we've done, I mentioned earlier, we have some community-based support. We have dental clinics. We've supported Mission of Mercy, as well as Team Smiles, basically treating over 15,000 patients in PA. This shows the mobile dental clinic support initiative that we've had since 2019. We started in collaboration with Highmark Health, and we've seen roughly close to 3,000 individuals who are either Medicaid, Medicare, CHIP, or ACA in PA and Delaware, providing almost close to 16,000 procedures. One of the challenges that we continue to have is the completion rate. We schedule patients, we call them the day before, we call them 2 days before, and then we'll call them the day before, and still we have issues with people not showing up for their appointments. We tend to average roughly about 40% of a show rate. So we obviously double book and triple book, but we're continuing to see increased utilization and increased support of this initiative. This shows that our mobile unit on the top right and some of our staff and what the mobile unit looks like. And we visited at this point over 16 cities in Pennsylvania providing dental care. And again, it's a great initiative for those patients who have difficulty in access getting in for dental care. You heard me mention our United Concordia Charitable Fund. That's something we started about 5 years ago. We focus on really 3 areas: workforce development, dental care for the underinsured and uninsured, and then some diversity, equity, and inclusion initiatives that focuses on oral health equity. Currently, we have given roughly several hundred scholarships to dental students and dental hygienists. We're now looking at providing scholarships for dental assistants because there are some dental assistant programs. We also found that obviously that's a significant workforce shortage area in some areas. There were a number of dental assistants who chose not to come back after COVID. I think we all are aware that there were dental hygienists who made that decision not to come back. But some of the research is showing that dental assistants is also a challenge for a number of offices. So we have some initiatives where we are supporting those. We obviously provide dental care to the underserved when it comes to children through Team Smiles as well as Mission of Mercy. And we also support the veterans. We have an initiative with NYU where we work very closely with them delivering dental care for veterans who do not have access to dental care. Based on their disability rating, a number of veterans may not receive dental care at a VA facility. So working with NYU and 3 VA facilities in that area, we've provided significant funds for them to receive comprehensive dental care if that's needed. You've heard me talk about the social determinants of health focus. We provide a significant amount of funds to food banks because we know that that is important. There are homeless shelters that we have supported. There is something called the Lancaster Cleft Palate Center in Lancaster. They provide dental care free of charge to anyone who needs it. And so we have provided funding and support to them. And so again, I'm really proud of the work that this charitable fund has done. To date, they've given probably close to $5.56 million addressing these four focused areas that's at the top of this. And then the last thing I want to talk about is the work that we're doing with Harmony Health. We're doing some salivary testing. There's a new code that's coming out this year in 2026 that will allow for point of care salivary testing to be covered. And so we are working with a company where we're doing a pilot where the objective is to improve access and improve engagement of patients who have had gaps in care. The way this works is salivary tests will be mailed to some patients who have had a gap in care. The objective is for them to complete the salivary test. And once they complete the salivary test, it will provide them real-time insight into the caries and gum disease index. There is a test that they can do. The American Diabetes Association has like a 60 seconds test you can do that gives you some insight as to your propensity for diabetes type 2. And so we're hoping that once people complete this, that they will have a sense as to what their oral health and their overall health is. And then we'll schedule an appointment or come back into the dental clinic or their dental home if they've had gaps in care. Again, this is an initiative that we're working with Pennsylvania Coalition of Oral Health, as well as some dental offices and healthcare professionals as well. The way this will work, as you'll see, it will provide sort of a dashboard, which is the caries management risk assessment, diabetes risk test, and we'll give them some insight on their cavities, gum disease, as well as diabetes. So again, this gives you just some insight as to the things that we are doing at United Concordia and as far as working collaboratively to improve health outcomes for our members. Again, as I mentioned earlier, total health is really the foundation of who we are. We see lots of benefits to work with others, to collaborate on the delivery of health care for all of our members to improve health outcomes. And again, whether that's oral health, physical health, whether it's financial health, it's working in the community, it's doing all of those things to really provide what's best for the patients and for the members. I'm going to turn things back over to you now, Gary, I think, and we'll go to the questions.
Great. Thank you, Dr. Allen, and thanks to everyone for participating. Before there's a couple questions that came to mind during this, but one came in that I thought maybe you could address pretty quickly. Amy Schwartz asked, can you talk about the impact of methamphetamine on dental health?
Can I talk about methamphetamine?
Yeah, and how it impacts dental health.
Yeah, it plays obviously a significant role. There's something called meth mirth, and it sometimes can be confused with Mountain Dew. But in essence, you end up getting a number of caries and then the breakdown of the enamel and dentin, and many of those patients end up in significant pain and discomfort. I think another challenge is that when individuals are in rehab, it is the delivery of care that they need afterwards that's really important also. Because in order for a number of these individuals to be really incorporated back into society where they feel good about themselves, they want to be employed, they obviously will require a significant amount of dental care and dental work in order to be done.
Okay, great.
Some of the other things that I think you also have to be aware of is that when you do have meth mirth, you end up with sort of a dry mouth or xerostomia. A number of these patients also end up with bruxism, where they clench or grind their teeth. Sometimes they will crave sort of sugary drinks, where they're drinking things like, again, Mountain Dew and some of those other sodas and things, which again are poor for them. which are not good for them. And then as I mentioned, a number of them will have very poor oral hygiene. They're not brushing and flossing properly, so they end up with issues like that.
All right, thank you. Thanks for the question. So while we're waiting for questions to come in, going back to the oral systemic connection, Dr. Allen, could you elaborate on a specific example of how improving oral health can directly impact the management or outcomes of a chronic systemic condition like diabetes or heart disease?
I can, and I think I would recommend that everyone go and look at a study that was done in, I believe it was March of 2022. It's in the compendium, but there was some research done with one of our partners, LSV, and they looked at a number of their members over 5 years. This was in Arkansas. And what they found is that those individuals who received preventive care, that they had a decrease in healthcare costs, especially a decrease in healthcare costs when they went into the hospital. And it primarily focused on those patients who had diabetes, who had coronary artery disease. And so they looked at it and found that there were decreased healthcare costs for that. But also when you combine those two together, people had diabetes and coronary artery disease, there was even more significant cost savings associated with that.
Great, thank you. So then going to the social determinants of health, you mentioned the importance of addressing them. What are some of the most significant barriers you see preventing Medicaid members from accessing necessary dental care, and what innovative approaches can UCD or is UC doing to overcome those?
Yeah, I think sometimes people forget that patients who are on Medicaid, they're on Medicaid for a particular reason. And many of them have various challenges in a variety of ways. And socioeconomics is generally one of the primary challenges that they have. And as a result of that, when you think about some of the socioeconomic challenges, I think one of the things that I always hear about is Medicaid members break their appointments. They're not very dependent. They don't show up. And I think it's important to keep in mind that they have a number of challenges. One of the biggest barriers could be transportation. If they have to take 1 or 2 buses in order to get to an appointment, or they have to find someone to take them to an appointment, obviously that can be a challenge. So I think transportation is a problem. I think also understanding that with most of the people on this webinar, I would bet that if they take time off from work, they take PTO, so they get paid. But we have to understand that with many people who are working hourly wages, when they take time off from work, they take a half a day off, they're missing work, they're not getting paid. And so as a result of that, I think that's a challenge. But one of the things that we've done, again, we focus on trying to re-engage with those patients. I think providers can offer, we've tried to work with some of our providers in offering hours that are available for the members. So maybe late hours, maybe working on Saturday. As I mentioned, I think the mobile dental van has been very beneficial for us. We also offer teledentistry. So if there is an emergency, it's not available for our Medicaid members at this point, but that is something that we're working on. But if we could offer teledentistry and provide that for just a consultation or an evaluation, prevents people from going to the emergency room, things like that.
Thank you for that. Then one other one that comes to mind, like in the medical dental integration that you spoke about, what do you see as some of the biggest challenges in implementing that, and how is UCD addressing them?
I think the biggest barrier to implementing medical dental integration is educating people about medical dental integration. I think it's a challenge because I find that many of the providers aren't aware of that relationship that exists between oral health and systemic health. Many of our members or patients aren't aware of that. and even some of the clients in the group. So they don't understand when we're trying to talk to them about various benefits, whether it's a Smile for Health benefit, meaning if you want to offer additional preventive services for certain members who have chronic conditions. I don't think, clients or people fully understand that. And so I think education is the biggest challenge. And I think the things that we're doing to address that, it's things like this. I think supporting webinars. I think we constantly are writing editorials or writing articles, trying to really help people understand the importance of medical dental integration and education and how it can improve health outcomes. One of the things I think a number of people are always looking for is what is the return on investment when you start doing this? And I think the point I want to make more than anything is that the biggest return on investment is that you're improving the health outcomes of the members. And if you improve the health outcomes, there are some cost savings associated with that.
Great, thank you. So just in general, like, I think there's a lot of, tech, in addition to the health plans, we're all thinking about technology and innovative ways to address some of the challenges. How do you see technology and innovative wellness programs evolving to further enhance preventive dental care, particularly for the Medicaid population?
I think there's going to be a great opportunity for seeing some improvements and improving healthcare for all members, not just Medicaid populations. I think, first of all, artificial intelligence, I think, will play a role in claims adjudication. I think claims will be able to adjudicate it much quicker. I think one of the greatest challenges, it seems, with dental carriers is related to bone levels and periodontal disease and what constitutes approval for scaling and root planing. I think artificial intelligence is going to enhance the ability of some of those decisions to be made much quicker and more sort of a standardized approach as it relates to that. I think we will, obviously, I talked a little bit about the salivary testing. I think we're going to continue to see a greater focus on salivary testing, identifying individuals who may have may be more prone to diabetes and identifying some of those chronic conditions through what's in the saliva. I also think that teledentistry has a potential to be utilized more, especially as it relates to dental hygienists who are able to work independently of dental offices. There are more and more states that allow dental hygienists to utilize that and to be able to provide preventive care in areas where there is a need. And then I mentioned earlier the work that we're doing with the integrated electronic health record. I think if there is a greater focus on integrated electronic medical and dental records, I think that will lead to some improvements as well.
Okay, I am not seeing any other questions coming in, and just want to be mindful of and respectful of everyone's time. As Patrick put in the chat to everyone, my email address is out there. If you have any follow-up questions, feel free to reach out. We're happy to discuss some of the great work that we're doing in partnership with our MCO partners to really drive better outcomes for the Medicaid population. So, Patrick, I think I could turn it over to you for closing this. But again, thank you everyone for your participation and your engagement, and we look forward to more conversations about this and collaborating with all of you to drive the best outcomes for the populations we're serving. Thank you.
Thank you. And thank you so much, Dr. Allen and Gary and the entire United Concordia Dental team for this great presentation. It's extremely important. As Gary said, reach out to him. You'll also be receiving the slides and a follow-up email feel free to reach out to MHPA. We're happy to connect you. And, with that, we'll have another webinar next week, same time, webinar Wednesdays. And I want to thank everyone for attending. Have a great afternoon.
Thank you all. Have a
Thank
good
you
day.
so much.